Welcome to Wise Elders Stories channel. Subscribe to Wise Elders Stories channel for more valuable insights. Have you ever observed an elderly loved one persistently scratching their skin and questioned whether it's merely dry skin or a harmless habit? Perhaps you've brushed it off as something trivial, only to notice that the itching persists or even intensifies. But what if that ongoing discomfort is trying to convey something much more significant about their health than you realize? It's simple to overlook, yet the reality is that chronic itching in older adults can often act as an important warning sign, indicating underlying health concerns that may need urgent attention. Seeking medical attention for chronic itching, especially in older adults, is crucial as it can indicate a serious underlying condition. If ignored, this issue may result in significant complications later on. In this video, we will guide you through 5 key areas of the body where ongoing itching could be a warning sign of a larger health concern. By recognizing these indicators, you will be better prepared to take prompt action and prevent potential issues from worsening. Stay with us for essential insights. Stay with us until the end of this video, where we will not only emphasize these crucial areas but also delve into how early detection can significantly impact the provision of appropriate care at the right moment. We will examine the common signs that indicate when it's time to seek advice from a healthcare professional and discuss how to address these symptoms before they escalate into more severe conditions. This video is a must-watch for anyone looking after elderly family members or friends, as being aware of what to observe could make a meaningful difference. Prevent long-term health issues and ensure that your loved ones receive the proper care when they need it most. By understanding these signals, you'll be empowered to make informed decisions about their health and well-being. Stay with us, because recognizing these signs can help you become a more attentive and proactive caregiver, offering peace of mind that you're catching potential health concerns early. With this knowledge, you'll be able to ensure your loved one's comfort, safety, and overall health. Don't miss out on these valuable insights. Let's jump right in. If you haven't subscribed to our channel yet, I strongly encourage you to do so and hit the notification bell to stay updated. Your support is incredibly valuable to me. If you found this video helpful, please consider liking and sharing it with your friends and family to help us spread these important lessons. Before we begin, I'd love to hear your thoughts on this video. If you enjoyed the topic, please comment with a 1. If you think there's room for improvement, feel free to comment with a 0. Inform me on how I can enhance the content for you moving forward. Now, let's delve into the indicators that could impact your loved one's health. One area to focus on is the lower legs and feet. When it comes to the well-being of our elderly relatives, we need to be acutely aware of even the slightest signs that something may be amiss. If you observe your loved one frequently scratching their lower legs or feet, this could indicate poor circulation. This issue, while often neglected, is unfortunately quite prevalent among older adults and can sometimes. There are indications of more serious underlying health issues, such as heart problems or blocked blood vessels. Circulatory problems in the legs can significantly hinder blood flow to the lower extremities, leading to incessant itching, discomfort, dryness, and even painful sensations. It's crucial to monitor this closely, particularly if your loved one exhibits other concerning signs, such as unusual fatigue or complaints of discomfort while walking. You may observe them taking frequent pauses during a leisurely stroll may arise, or they might express that their legs feel fatigued or achy after just a brief duration. For older adults already managing chronic conditions such as diabetes or hypertension, the threat of inadequate circulation becomes increasingly significant. In these situations, the necessity to stay alert and take initiative is heightened. It can be tempting to dismiss signs of poor circulation, yet overlooking them could result in serious repercussions if not addressed. Complications such as ulcers, infections, or even more critical issues could develop. Cardiovascular complications can emerge, significantly impacting your loved one's quality of life. Picture witnessing someone you cherish grappling in silence, unaware of the extent of their suffering until the situation has deteriorated. This is why I implore you to act promptly. If you observe not only itching but also alterations in skin color, noticeable swelling, or cramping, it is vital to seek medical advice immediately. Early detection and treatment can be pivotal in averting these complications. Encouraging your loved one to remain active is essential, whether through gentle movements like walking or stretching. These small efforts can greatly enhance blood circulation, alleviate discomfort, and transform their overall well-being. As caregivers, we bear the responsibility for not only their physical needs but also their emotional health. By being attentive and proactive, you can help your elderly loved one sidestep unnecessary suffering and provide them with the support they need. Living a full and comfortable life for as long as possible involves recognizing the subtle changes our bodies undergo as we age. Often, these changes go unnoticed until they become too pronounced to overlook. One such change, particularly concerning our elderly loved ones, is persistent itching at the back of the neck. While it may appear to be a minor annoyance, this constant scratching could indicate a deeper issue, one that may significantly impact health and comfort. As time passes, the loved one may experience subtle changes that become more pronounced with age. The spine and its surrounding structures gradually wear down, increasing vulnerability to various issues, particularly in the neck area where nerves are densely packed and highly sensitive. The neck plays a vital role in supporting the head, enabling movement, and containing a complex network of nerves that connect to the rest of the body. As the spine undergoes its natural transformations with age, it can place pressure on these delicate structures. The pressure on nerves can result in uncomfortable, and at times, painful symptoms. One of the initial indicators may be a persistent itch at the back of the neck. While this itching might appear harmless, it could signal nerve compression or other spinal disorders stemming from conditions like arthritis, herniated discs, or degenerative spine issues. These conditions exert pressure on the nerves, leading to sensations that can vary from mild itching to more intense symptoms, including tingling, numbness, or sharp, stabbing pain. It can be quite simple to overlook a scratch or two, particularly when they appear on the back of the neck, an area that often escapes our notice. Yet, it's crucial to consider the broader context and take note of any other symptoms that might arise alongside this discomfort. Itching can easily be disregarded until it develops into a more serious issue. If someone you care about starts to suffer from frequent headaches, struggles to turn their head completely, or reports feelings of tingling or numbness extending down their arms, it's essential to pay attention. These indicators suggest that there may be a more serious underlying issue at play. Nerve pressure or spinal problems typically do not confine themselves to a single area. They can create a cascading effect that influences mobility, muscle control, and overall comfort. As caregivers, it is essential to take a proactive approach in recognizing these signs early on to avert more severe complications that could impact your loved one's quality of life. If you are still engaged with this video and find these insights valuable, please comment 1 below to let me know you are still present. The emotional burden of witnessing a loved one in distress can be profound. It often feels like a heavy weight rests on our shoulders to ensure their well-being, leaving us to question whether we are doing all we can. This is why it's essential to pay attention to even the smallest symptoms, such as itching at the back of the neck, which may appear trivial. Acting swiftly upon noticing these signs can lead to significant outcomes. Early intervention is vital in averting the progression of more serious health issues, and seeking a doctor's advice is the first step. The initial step in identifying the underlying cause of the symptoms, be it arthritis, a herniated disc, or another spinal issue, is obtaining an early diagnosis. This timely identification opens the door to exploring treatment options that can ease discomfort and enhance your loved one's quality of life. Once a spinal condition is diagnosed, a range of treatment strategies can assist in managing symptoms and potentially reversing some damage. Physical therapy, in particular, can be highly effective in relieving nerve pressure and enhancing spinal alignment, addressing not only the experiencing physical discomfort can be challenging, yet it is essential to focus on maintaining muscle strength, flexibility, and mobility. Medications like anti-inflammatory drugs may be prescribed to alleviate pain and reduce inflammation in the spine and nerves. These treatments not only offer much-needed relief but also enhance emotional well-being by promoting overall health and a sense of independence. However, it's crucial to recognize that effective management goes beyond medical interventions. It also involves adopting lifestyle changes that foster spinal health and holistic well-being. Encouraging a loved one to maintain good posture can greatly alleviate strain on the neck and spine. Often, we overlook the impact of poor posture on the body, especially in the elderly, where muscle weakness and joint stiffness are prevalent. Simple habits, such as sitting up straight and avoiding slouching, can significantly prevent unnecessary pressure on the spine. Furthermore, integrating regular stretching and gentle exercises into their daily routine can enhance flexibility and relieve tension in the neck and upper back. These small everyday actions serve not only as practical solutions but also as a means of self-care that can enhance both physical and emotional well-being. The stretching and gentle movements foster improved circulation, alleviate stiffness, and diminish the risk of future injuries. As you embrace these changes, keep in mind that emotional support holds equal significance to physical treatment. Aging can often feel isolating and frustrating, particularly when navigating chronic discomfort or limitations in movement. Compassion, patience, and understanding can truly transform situations. Taking the time to listen to the concerns of loved ones, validating their feelings, and providing reassurance that they are not alone in their challenges can create a profound impact. Knowing that someone genuinely cares about their well-being can bring a sense of comfort and peace, aiding them in coping with the emotional toll of aging. Ultimately, the aim is to enhance the quality of life for those we care about, physically, emotionally, and mentally, ensuring they feel heard, supported, and empowered. Implement modifications that can enhance their well-being. Often, the tiniest tweaks can lead to significant improvements in their health and joy. By remaining attentive to indicators such as itching at the back of the neck, taking initiative in obtaining medical guidance, and creating a nurturing atmosphere of emotional support, you can assist your cherished one in gracefully managing the trials of aging with comfort and tranquility. Regarding the chest and upper torso, if your elderly loved one starts to notice ongoing itching in this area, the presence on their chest or upper torso could indicate something far more significant than a mere skin irritation. At first glance, it may appear to be a minor nuisance, easily overlooked. However, upon closer inspection, this symptom might serve as an early warning sign of more serious issues, such as heart or lung problems. Detecting these subtle changes is not always straightforward, particularly in older adults, as our loved ones may be too proud or too accustomed to discomfort to voice their feelings. Nevertheless, as caretakers, we bear the important duty of remaining particularly observant. Our aging parents, grandparents, and loved ones may not always express their health concerns directly, so we need to be attuned to even the slightest indications that something may be amiss. The skin on the chest and upper torso is notably sensitive and can respond to various internal changes within the body, especially during fluctuations in blood flow. When heart and lung conditions arise, the body may attempt to signal distress in ways that are not readily apparent. Itching can often be overlooked as a mere annoyance or a trivial issue, yet it may signal something more significant that demands our prompt consideration. This symptom isn't merely a result of dry skin, it could suggest underlying problems with circulation, respiratory function, or overall cardiovascular health. Reflecting on when the itching becomes particularly pronounced, during exercise, physical exertion, or stressful moments, can provide valuable insights into its potential implications. This observation uncovers a troubling pattern that emerges during heightened physical activity, such as walking or exercising. For individuals with underlying cardiovascular conditions, the heart rate naturally escalates, placing additional strain on the heart. This added stress can intensify existing issues, making problems like poor circulation or respiratory distress more evident. The itching experienced during these activities transcends a simple bodily reaction to exertion. it may indicate that the heart or lungs are having difficulty meeting the body's demands. If the itching intensifies during moments of oxygen and blood flow, it may signal a deeper issue that warrants attention. Additionally, observe closely if the itching arises during periods of rest, especially at night when your loved one is lying down or attempting to sleep. This is typically when the body is most relaxed, making any problems with blood flow or breathing more apparent. Should your loved one experience an increase in itching during these times, it could indicate a significant concern. Their breathing may be compromised, particularly for older adults, as breathing problems often intensify when lying down. This change in body position can impact lung capacity and the heart's ability to circulate blood effectively. Such symptoms could indicate that the body is struggling to meet the demands placed on its organs. Ignoring these signals might result in more serious complications later on, with conditions like congestive heart failure, chronic obstructive pulmonary disease, or arrhythmia potentially arising. Individuals may exhibit symptoms such as itching discomfort or skin reactions in the chest and upper torso. Congestive heart failure, for instance, frequently presents with swelling in the legs and abdomen, shortness of breath, and even skin reactions due to fluid accumulation in the body. Chronic obstructive pulmonary disease can lead to persistent coughing, breathing difficulties, and overall inadequate oxygenation, potentially resulting in skin discomfort or itching. Irregular heartbeats can disturb the normal blood flow, causing symptoms like dizziness and palpitations in certain instances. Itching or discomfort in the chest area should not be dismissed as mere inconveniences. They serve as critical warning signs that demand attention. It is vital to stay vigilant and observe for additional symptoms that may accompany the itching. Watch for indicators such as shortness of breath, which could imply inadequate oxygen supply to the lungs, or dizziness, suggesting insufficient blood flow to the brain. Any alterations in a loved one's capacity to carry out daily tasks, such as getting up or moving around, warrant careful consideration. Rising from a chair, moving about the house, or even engaging in everyday activities like cooking or bathing should not be dismissed. These seemingly minor changes in one's abilities can serve as crucial indicators that the body may not be operating as it used to. If someone is finding it difficult to manage tasks they once performed with ease, it is essential to take action. When these signs emerge, the urgency of seeking medical attention becomes paramount. Consulting a healthcare provider promptly is vital to eliminate any serious concerns. Recognizing underlying conditions is crucial. Early intervention plays a vital role in halting further health decline. Often, the earlier a condition is identified, the more manageable it becomes with prompt medical attention. Many of these issues can be effectively controlled, allowing our loved ones to maintain a fulfilling life. We must not overlook these subtle indicators. As difficult as it may be, we must confront the possibility that our loved ones may require more assistance than we initially perceive. The truth is that aging brings its own set of challenges. There is a heightened risk for heart and lung issues, and tackling these concerns early can avert serious complications down the line. By remaining vigilant about symptoms such as persistent itching and other related signs, we can help ensure that our loved ones get the necessary care to uphold their health and well-being for as long as possible. While this may seem daunting, it's important to remember that even small actions taken now could be crucial in safeguarding their health and happiness for years ahead. Their well-being is a priority we must cherish. We must advocate with love, attention, and persistence, as it can profoundly impact our lives. Let's not delay our actions until it's too late. As our loved ones grow older, we often observe subtle changes in their bodies that reveal much about their health and well-being. One such change that might not be immediately recognized as a serious concern is persistent itching in the hands and wrists. If your elderly loved one is facing this discomfort, it signifies more than just a minor annoyance. This may signal deeper, more significant issues like arthritis or circulatory problems, which can severely impact quality of life. It's disheartening to consider that something as minor as a slight itch could foreshadow larger, more daunting challenges in daily living. Arthritis, whether osteoarthritis or rheumatoid arthritis, is a prevalent cause of itching in the hands and wrists. It's not merely the skin responding to inflammation, it's the joints themselves that are affected. That are inflamed, stiff, and swollen, often causing persistent discomfort that can be both frustrating and demoralizing. Witnessing loved ones struggle to move their hands, something as simple as holding a cup of coffee can feel like a monumental task. The impact of arthritis on their joints can severely limit their mobility, transforming activities that once seemed trivial, like dressing, cooking, or even brushing their teeth, into monumental challenges. The emotional toll of this loss of independence is often invisible, yet profoundly felt. It doesn't end there. If the itching comes with other symptoms like pain, swelling, or a tingling sensation, these could signal nerve compression or joint damage that needs urgent care. As the condition advances, it can take away the freedom and joy your loved one once experienced. You can't help but feel powerless as they navigate each day, longing for something, anything, that might bring them relief, even if just for a fleeting moment. Additionally, circulatory issues may also contribute to ongoing discomfort. Itching in the hands and wrists should not be underestimated. When blood flow is compromised, it results in dryness and irritation, intensifying your loved one's discomfort. The implications extend beyond mere itching. This persistent discomfort can serve as a warning sign for more serious conditions like diabetes, hypertension, or peripheral artery disease, PAD. As the heart and vessels struggle to function effectively, it can be disheartening to witness how something as seemingly simple as inadequate circulation can gradually undermine overall health and well-being of someone you care about deeply. If you are still watching this video and find these lessons useful, please comment "Tobe" below to let me know that you are still here with me. If your loved one is experiencing these symptoms, it's crucial to take action. Seeking advice from a healthcare provider can be a first step toward finding relief. Medications, physical therapy, and even lifestyle changes might be recommended to ease the pain, improve their mobility, and help them regain some independence. Encouraging gentle. Engaging in exercises, stretching, and maintaining an active lifestyle can significantly contribute to joint flexibility and enhance circulation. However, the journey extends beyond mere physical treatments. It encompasses emotional support as well. Being present for a loved one during challenging times, whether by offering a listening ear or simply holding their hand, can truly make a difference. After all, it's those small, loving moments that provide a sense of peace and comfort amidst discomfort and distress. As we age, our bodies inevitably undergo changes, particularly in the lower back and hips. A multitude of changes occurs, many of which may initially seem subtle but eventually become more pronounced. One of the most concerning and often overlooked symptoms that can arise during these years is persistent itching, particularly in the lower back and hips. While itching may appear to be a minor nuisance, it can signal that something more serious is happening beneath the surface. It's easy to dismiss these sensations as merely part of the aging process, but approaching these signs with care and attentiveness is essential. At times, the body's signals are conveying crucial messages. Persistent itching in certain areas may indicate underlying issues with kidney function. If not addressed, this can escalate into more serious health concerns, such as kidney disease or even kidney failure. When the kidneys are compromised, they struggle to eliminate waste and toxins, which can accumulate in the bloodstream. This buildup often manifests as skin reactions, including itching, with the discomfort potentially being localized. The lower back and hips, where the kidneys reside, can often be overlooked when it comes to symptoms like itching, which might be brushed off as mere dry skin or an allergic reaction. However, we must pay attention to the bigger picture. If someone dear to you is showing additional signs of kidney distress, such as leg swelling, persistent fatigue, or alterations in urination, it's vital to pursue medical attention promptly. Early diagnosis of kidney issues leads to more manageable outcomes and enhances our ability to safeguard the well-being of those we care about. Yet, it's essential to remember that it's not solely about As our spine ages, the nerves in our lower back become increasingly susceptible to compression. Conditions such as arthritis, herniated discs, or spinal stenosis, which are common as we grow older, can exert mounting pressure on these nerves. This pressure often leads to pain, tingling, and that frustrating itching sensation. It's truly disheartening to envision someone enduring this, particularly when it disrupts their daily activities. Frustration can easily arise, often dismissed as a natural part of aging. However, it's crucial to recognize that persistent discomfort or itching, despite the use of topical treatments, may indicate increasing pressure on the spinal nerves. No one should endure such pain without clarity on its origins. It's vital to discuss these symptoms with a healthcare provider promptly, as neglecting them could result in more serious complications in the future. The underlying issue may stem from kidney dysfunction or nerve compression. Early detection plays a crucial role in managing the situation and averting further complications. It is essential to remain alert, heed the signals our bodies send, and seek the appropriate assistance before matters worsen. As discussed, ongoing itching in the lower back and hips might signify more than mere discomfort. It could indicate a need for attention, whether related to kidney function or spinal nerve compression. By being observant, we can address these concerns effectively. By recognizing these symptoms and addressing them promptly, we can avert more severe health issues down the line. So, what insights have you gained today that could alter your approach to your own health or that of someone you care about? I would love to hear from you. Please leave a comment below this video and share one thing you've learned today that you plan to incorporate into your life. Is it being more attuned to your body's signals, or maybe understanding the significance of seeking medical advice sooner? Whatever it may be, we want to hear it. If you enjoyed this video, please take a moment to share your thoughts below, and remember to like, share, and subscribe to our YouTube channel for more valuable insights on health and well-being. Let's keep this journey going together, supporting one another as we strive for healthier, happier lives.